I am about to show you exactly how the position you choose tonight will determine whether you wake up with renewed energy or stiff, aching joints tomorrow morning. We are going to rank the most common sleeping habits from the absolute worst, which silently damages your spine, to the gold standard that can actively reduce your pain levels while you dream. You might believe that your morning stiffness is just a normal part of aging, or that the burning sensation in your chest is just something you have to live with. But in reality, these are often direct consequences of how you arrange your skeleton for 8 hours every night. I have seen countless patients chase their pain with medications, injections, and endless therapy sessions, never realizing that they are undoing all that progress the moment they close their eyes. I remember a patient named Arthur, a 68-year-old retired engineer who came to me with chronic, mysterious neck pain and numbness in his fingers that no amount of stretching seemed to fix. He was convinced he had a pinched nerve from his gardening hobby, but after weeks of investigation, we discovered the culprit was not his daytime activity, but the specific, twisted way he slept every single night. Once we corrected his alignment, his symptoms didn't just improve, they vanished entirely, revealing that his chronic condition was actually a repetitive injury caused by his mattress habits. Before we begin, a critical disclaimer. The information I'm sharing today is strictly for educational purposes. Always consult with your. Let's start. 1. The stomach sleeper, the neck wringer. The first position we must address, and the one that ranks as the absolute worst for anyone over the age of 60, is sleeping flat on your stomach. If you currently sleep this way, your immediate goal should be to transition away from it because it places an extraordinary amount of mechanical stress on your cervical spine, essentially wringing out your neck like a wet towel for hours at a time. When you lie on your stomach, you cannot breathe through your pillow, which forces you to turn your head 90 degrees to the side, locking your neck joints in their maximum end range of rotation. This matters because as we age, the facet joints in our neck naturally develop signs of wear and tear, often becoming arthritic or stiff. Forcing these aging joints into extreme rotation and then adding the weight of your head creates a compressive force that can pinch nerves and strain the delicate ligaments that hold your spine together. Imagine holding your head looked all the way to the left for 8 hours while you are awake. The pain would be unbearable. Yet this is exactly what you are doing to your unconscious body when you sleep on your stomach. I recall a patient named Margaret, 72, who suffered from chronic headaches and a persistent dizziness that her neurologist struggled to diagnose. She was a lifelong stomach sleeper, unaware that the extreme rotation of her neck was compressing the vertebral arteries, which supply blood to the brainstem. We worked on a gradual transition strategy to get her off her stomach, and within 2 weeks, not only did her neck stiffness disappear, but her morning dizziness resolved completely as blood flow was no longer being mechanically restricted during the night. The problem extends beyond just the neck. Stomach sleeping also forces your lower back into extension, swaying the spine and compressing the lumbar discs. When you sink into a mattress face down, your belly acts as a fulcrum, arching your back and jamming the posterior joints of your spine together. For seniors with spinal stenosis or arthritis in the lower back, this position is practically guaranteed to result in morning soreness and a feeling of locking up that takes hours to shake off. To correct this, you cannot simply force yourself to sleep on your back immediately, as old habits are hard to break. Start by placing a firm pillow under your chest and pelvis to reduce the arch in your lower back, or try sewing a tennis ball into the front pocket of a t-shirt to make rolling onto your stomach uncomfortable. The most effective transition is often to use a body pillow. Hug it tightly while lying on your side, as this mimics the sensation of pressure on your front that stomach sleepers crave, but keeps your spine in a neutral, safe alignment. Another critical anatomical concern is the impact on your shoulders. When you lie on your stomach, you typically have to raise your arms above your head or tuck them under the pillow to support your neck. This places the shoulder joint in a position of abduction and external rotation, which can impinge the rotator cuff tendons against the bone. Over time, this repetitive impingement can lead to tendinitis or bursitis, making it difficult to lift your arms or carry groceries during the day. If you absolutely cannot sleep any other way, you must modify the position to reduce the damage. Try removing your pillow entirely to keep your head flatter, or place a very thin pillow under your hips to lift your lower back and flatten the lumbar curve. However, understand that these are damage control measures, not solutions. The ultimate goal for your spinal health is to leave this position behind entirely. This supports the long-term integrity of your cervical discs. 2. The tight fetal position, the arthritis accelerator. The second position on our list is a very common variation of side sleeping, often called the tight fetal position, which ranks as bad due to its tendency to exacerbate joint stiffness and restrict deep breathing, while side sleeping can be healthy. Curling your body into a tight ball with your knees pulled all the way up to your chest creates a state of prolonged flexion that mimics the sitting position you likely spend too much time in during the day. This position effectively locks your hips and spine into a forward curve, reinforcing poor posture and limiting your mobility. This is particularly detrimental for seniors because it encourages the shortening of the hip flexor muscles, specifically the psoas muscle, which connects your lower spine to your thigh bone. When these muscles are kept short and tight all night, they pull on your lower back when you try to stand up in the morning, leading to that familiar stooped posture where it takes a few minutes of walking to fully straighten up. You are essentially training your body to be stuck in a seated shape even while you are resting in bed. I remember a patient named John, 65, who came to me complaining of shallow breathing and a constant dull ache in his hips that made his morning walks difficult. He slept curled up so tightly that his knees nearly touched his chin, a habit he had developed to keep warm. We taught him to open up his sleeping posture, extending his legs slightly and keeping his spine straighter, and the change was remarkable. His morning hip pain decreased significantly, and he reported feeling more refreshed because his diaphragm had room to expand fully during the night. The restriction of the diaphragm is a key issue with this position. When you are curled into a ball, your abdominal contents are compressed upwards against your diaphragm, preventing it from descending fully with each breath. This forces you to take shallow upper chest breaths rather than deep, restorative belly breaths. Oxygenation is crucial for tissue repair during sleep, and by mechanically limiting your lung capacity, you are depriving your body of the fuel it needs to heal from the day's stressors. To fix this, you need to consciously uncurl before you drift off to sleep. Lie on your side but extend your legs down so that your knees are only slightly bent, and ensure your back is relatively straight rather than rounded like a C shape. Think of it as a loose fetal position rather than a tight one. You want to maintain the natural curves of your spine, not exaggerate them into a ball. A vital addition to this position is placing a pillow between your knees. Without this pillow, your top leg will inevitably slide forward and down, twisting your pelvis and pulling on your lower back. This rotation creates torque in the lumbar spine that can aggravate disc issues and strain the sacroiliac joint. A pillow keeps your hips stacked squarely on top of one another, maintaining a neutral alignment that allows your muscles to relax completely rather than guarding against the twist. You should also pay attention to your head position. In the tight fetal position, people often tuck their chin down toward their chest, which strains the muscles at the base of the skull and can lead to tension headaches. Ensure that your pillow is thick enough to fill the gap between your ear and the mattress, keeping your neck in a straight line with the rest of your spine. Your chin should be in a neutral position, not tucked down or jutting forward. This position creates a sense of psychological comfort and security, which is why it is so popular. But for the aging body, mechanical freedom is more important than that tight, cozy feeling. By opening up your joints and allowing your chest to expand, you turn a damaging position into a neutral one. This simple change supports better hip mobility and deeper, more oxygen-rich breathing throughout the night. 3. Right side sleeping, the acid trap. The third position we need to discuss is right side sleeping, which ranks as poor specifically for seniors who suffer from acid reflux, heartburn, or GERD. While sleeping on your side is generally better for your spine than sleeping on your stomach, the side you choose makes a profound difference in how your digestive system functions due to the specific anatomy of the human stomach. Your stomach is a curved organ that sits naturally on the left side of your abdomen, shaped somewhat like a kidney bean. This matters because the connection between your esophagus and your stomach, the lower esophageal sphincter, is located on the right side of the stomach's upper curve. When you lie on your right side, your stomach is positioned above your esophagus, and gravity encourages stomach acid and food contents to pool against this valve. As we age, this valve naturally weakens, and the added pressure of gravity can cause it to leak, allowing corrosive acid to wash back up into your throat, causing damage and disrupting your sleep. I had a patient named Susan, 70, who had been prescribed increasingly strong antacids for her nighttime heartburn, which was causing her to wake up coughing and choking. She mentioned casually that she always slept on her right side so she could face the door. We advised her to switch to her left side and use a wedge pillow to elevate her torso slightly. The improvement was drastic. Her reliance on medication dropped by half, and the chronic cough that had plagued her for months disappeared as her esophagus was finally allowed to heal. The mechanics of this are simple physics. When you lie on your right side, the exit of the stomach, the pyloric valve, is pointing down, which helps empty food into the intestines, but the entrance, the esophageal valve, is submerged in the stomach contents. This is a recipe for reflux. Conversely, when you lie on your left side, the stomach hangs down below the esophagus. The acid pools harmlessly in the bottom of the stomach, far away from the delicate valve, and gravity actively works to keep the acid where it belongs. It is important to note that this advice applies even if you do not feel the burning sensation of heartburn. Many seniors experience silent reflux, where acid vapor travels up the esophagus and irritates the throat and vocal cords without causing the classic chest pain. This can manifest as a chronic need to clear your throat, a hoarse voice in the morning, or a persistent dry cough. If you have these symptoms, your right side sleeping habit could be the hidden cause. To implement this change, you can use positional therapy techniques to keep yourself off your right side. A simple trick is to sew a pocket onto the right side of a pajama shirt and insert a foam roller or a tennis ball, which will make it uncomfortable to roll onto that side during the night. Alternatively, you can place a large body pillow behind your back while you lie on your left side. This acts as a bumper, preventing you from rolling backwards onto your back or over onto your right side. For those with heart failure, however, the advice becomes more complex. Some studies suggest that right-side sleeping can lower heart rate and blood pressure in certain cardiac patients because the heart is held in place by the mediastinum, whereas left-side sleeping allows the heart to shift and turn slightly. If you have a serious heart condition, you must consult your cardiologist. But for the vast majority of seniors dealing with digestive slowing and reflux, the right side is a trap to be avoided. If you struggle to stay on your left side, consider investing in a contoured leg pillow. Often, discomfort in the hips or knees is what drives people to toss and turn. By stabilizing your lower body with a pillow between your knees, you make the side sleeping position more sustainable for longer periods, allowing you to reap the digestive benefits without waking up in pain. This positional strategy is effectively a mechanical treatment for a chemical problem. Instead of just neutralizing the acid with drugs, you are using gravity to prevent the exposure in the first place. It is a fundamental shift in how you manage your digestive health overnight. This supports the protection of your esophageal lining and improved digestion. 4. The starfish, your arms overhead, the nerve pincher. The fourth position is sleeping on your back with your arms raised above your head, often called the starfish, which ranks as problematic due to the risk of nerve impingement and shoulder pain. While back sleeping is generally good for the spine, adding the overhead arm position introduces a significant mechanical flaw that can lead to numbness, tingling, and long-term shoulder dysfunction. When your arms are overhead, the bundle of nerves that travels from your neck into your arm, the brachial plexus, can become stretched or compressed against the structures of the shoulder girdle. This is a major issue for seniors because the space available for these nerves naturally narrows with age due to arthritis and changes in posture. Keeping your arms in an overhead position for hours creates a traction injury on these nerves, which is why you might wake up with dead hands or pins and needles in your fingers. Furthermore, This position places the rotator cuff tendons in a shortened, impinged state, cutting off their blood supply during the very time they are supposed to be healing from the day's use. I recall a patient named David, 69, who was a carpenter and relied on his hands for his livelihood. He began experiencing profound weakness in his grip and a tingling sensation in his pinky and ring fingers that would not go away. He feared he had carpal tunnel syndrome, but our evaluation pointed to his neck and shoulder. He slept every night with his hands tucked behind his head, relaxing in a way that was actually strangling his ulnar nerve. Once he retrained himself to sleep with his arms by his sides, the sensation returned to normal within weeks, saving him from unnecessary wrist surgery. The overhead position also encourages mouth breathing and snoring. When your arms are up, your chest muscles are pulled tight, which can slightly alter the mechanics of your rib cage and neck. This tension can pull on the jaw, causing it to drop open, which leads to a dry mouth and an increased risk of airway collapse. For anyone with mild sleep apnea or a snoring problem, raising the arms is often an unconscious habit that makes the condition worse. To correct this, you need to actively practice keeping your arms below shoulder level. The safest place for your arms is resting gently by your sides or on your stomach. If you find it difficult to keep them down, try hugging a pillow or a folded blanket on your chest. This gives your arms a place to rest that keeps the shoulders in a neutral, safe position while preventing them from drifting up over your head during deep sleep. If you have a history of shoulder pain or rotator cuff tears, this adjustment is non-negotiable. The overhead position is essentially a stress test for your shoulder joint, and doing it for 8 hours a night is a recipe for chronic inflammation. You want your shoulders to be depressed and relaxed, away from your ears, allowing the blood to flow freely to the tendons and muscles. Sometimes people adopt this position because their mattress is too soft, and they feel the need to anchor themselves by grabbing the pillow or headboard. If you find yourself constantly reaching up, check your mattress support. A firmer surface might provide the stability your body is seeking, allowing your arms to relax naturally at your sides. It is also worth checking your pillow height. If your pillow is too flat, you might be putting your arm under your head to add height. In this case, buying a thicker pillow or a contoured cervical pillow will eliminate the need for your arm to act as a prop, saving your shoulder from unnecessary strain. The goal is to have the bed support you, not for you to support yourself. By lowering your arms, you are releasing the tension on the delicate network of nerves that power your hands and fingers. You are also allowing your shoulder joints to sit in their most open, decompressed state. This simple change supports the long-term health of your upper extremities and prevents the morning numbness that can be so alarming. 5. The soldier, flat back, the airway blocker. We now move into the territory of positions that have significant benefits but carry one major, potentially dangerous flaw for seniors. Sleeping flat on your back with your arms by your sides, often called the soldier position, ranks as mixed, because while it is structurally excellent for your spine, it is often terrible for your airway. When you lie completely flat, gravity pulls the soft tissues of your throat, including your tongue and soft palate, backward. As we age, the muscle tone in our throat naturally decreases, making it much more likely for these tissues to collapse and block your windpipe during deep sleep. This matters because this collapse is the mechanical cause of snoring and obstructive sleep apnea, a condition that deprives your brain and heart of oxygen hundreds of times per night. You might think you are sleeping soundly because you are not waking up, but your body is in a constant state of microarousal, fighting to breathe. This chronic lack of oxygen places immense strain on the cardiovascular system, increasing the risk of hypertension, stroke, and arrhythmias in adults over 60. You are essentially holding your breath for hours, stressing your heart when it should be resting. I remember a patient named Walter, 74, who prided himself on his perfect posture, even in sleep. He slept rigidly on his back without a pillow, believing it was best for his spine. However, his wife reported he snored like a freight train, and he complained of constant daytime fatigue and morning headaches. We ordered a sleep study, which revealed his oxygen levels dropped dangerously low every time he rolled onto his back. By simply elevating his head or switching to his side, his oxygen levels normalized and his unexplainable fatigue vanished. Despite the airway risks, this position is strictly the best for keeping the spine in a neutral alignment if you do not have breathing issues. It evenly distributes your body weight across the widest possible surface area, minimizing pressure points on your hips and shoulders. For someone with severe arthritis in the joints or bursitis in the hips, the soldier position can be a godsend because it avoids the direct pressure that side sleeping exerts on those tender areas. To make this position safer, you absolutely must elevate your head. Using a wedge pillow or raising the head of your adjustable bed frame by just 10 to 15 degrees can use gravity to keep your airway open. This small angle prevents the tongue from falling back as severely, reducing the snoring vibration and allowing air to flow freely. You get the spinal alignment benefits of back sleeping without the suffocation risk of the flat position. A common mistake is using a pillow that is too high, which flexes the neck forward and actually restricts the airway more, or using one that is too soft, allowing the head to tilt backward. You need a pillow that supports the natural curve of your neck, keeping your ear in line with your shoulder. A cervical contour pillow is often the best choice here, as it cradles the head and supports the neck arch. If you are unsure if this position is affecting your breathing, ask your partner or record yourself sleeping. If you hear gasping, choking, or long pauses in breath, the soldier position is likely dangerous for you without modification. However, if your breathing is silent and rhythmic, this position acts as a reset button for your posture, undoing the hunching and slumping of the day. This position also has a cosmetic benefit often overlooked. It prevents sleep wrinkles. When you squash your face into a pillow for 8 hours, you etch creases into your skin that become permanent over time. By sleeping on your back, your face remains untouched, and any facial creams or treatments stay on your skin rather than rubbing off onto the pillowcase. This supports both your spinal health and your skin integrity, provided your airway remains clear. 6. Left side sleeping. The brain cleaner. Moving up our rankings to good, we find the left side sleeping position, which is scientifically superior to the right side for digestion, but also holds a fascinating benefit for brain health. Recent research into the glymphatic system, the brain's waste clearance pathway, suggests that sleeping on your side, particularly the left, may be the most efficient position for flushing out metabolic waste products that accumulate in the brain during the day. These waste products include beta-amyloid proteins, which are associated with cognitive decline and Alzheimer's disease. This is a critical insight for seniors because the efficiency of this cleaning system naturally declines with age. By positioning yourself on your side, you mechanically assist the flow of cerebrospinal fluid through the brain tissue, allowing it to wash away the cellular trash more effectively than when you are on your stomach or back. It is somewhat like tilting a dirty pan in the sink to let the soapy water rinse the grime away. Gravity and position help the fluid move where it needs to go. I recall a patient named Helen, 70, who was worried about her memory and felt foggy every morning until noon. She was a restless sleeper who often ended up on her back. We discussed the glymphatic research and worked on keeping her on her left side using a body pillow. While we cannot promise to prevent disease with sleep position alone, she reported that after a month of consistent side sleeping, her morning mental clarity had noticeably improved, and she felt sharper and more alert upon waking. Beyond the brain, left side sleeping is the anatomical champion for digestion, as we touched on earlier. The stomach's shape allows food to sit comfortably in the main chamber, and the pancreas hangs freely without being squashed by the stomach, which allows digestive enzymes to flow freely. For anyone with slow digestion or constipation, common issues in the 60-plus demographic, this position uses gravity to help move waste through the ascending, transverse, and descending colon. To do this correctly, you must ensure your neck is aligned. A common error is using a pillow that is too low, causing the head to tilt down toward the mattress, straining the neck muscles on the upper side. You need a pillow that fills the exact distance between your ear and the edge of your shoulder. When you lie down, your nose should be parallel to the ground, not pointing up or down. You should also curl your legs slightly, but not too much. As we discussed with the fetal position, you want a loose bend in the knees to take pressure off the lower back without tightening the hip flexors. Placing a pillow between your knees is non-negotiable here. It locks the pelvis in a neutral position and prevents the top leg from dragging your spine into a twist. If you have a known heart condition like congestive heart failure, some cardiologists might advise against the left side because it can theoretically increase pressure on the heart due to gravity. However, for the vast majority of seniors with normal heart function, the benefits for the brain and gut make this the superior side sleeping choice. It is a simple, mechanical advantage you can give your body every single night. This position is also excellent for reducing snoring compared to back sleeping. By turning on your side, you prevent the tongue from falling back into the throat. For many patients with mild sleep apnea, simply stitching a tennis ball onto the back of their pajamas to keep them on their side is as effective as more invasive treatments. This supports a cleaner brain, a happier gut, and a quieter night's sleep. If you know someone over 50 who could benefit from this, share this video, and subscribe for more simple health tips.